Hi, I'm Dr. Alper Gökçe. Our today's topic is joint degeneration and its treatment alternatives. Recently, you are hearing more often the terms like anti-aging, well-aging getting discussed commonly. As you know, every human gets older in his life throughout a past amount of years. There are conceptual approaches to protect healed or some certain organs against degeneration and negative effects of aging. The joints are delicate tissues prone to degenerative mid-meniscal friction in a way of wear and tear. These occur at the surface of long bones, usually and in joints wrapped with chondral tissue or enabling the motion. The nature of joint cartilage is smooth and lubricious like the surface of ice for easing joint gliding with minimum resistance. However, it has a fragile nature and doesn't able heal itself when the integrity of the surface of the cartilage gets wounded. Before we are going to talk about repair mechanism and the regeneration process of cartilage and degenerated joints, briefly I want to give some short information about the structure of it. The cartilage is composed mainly by collagen type 2 and glucosaminoglycans, but water content is up to 80% of it. Chondrocytes are the name of the cells reside in deep layers of cartilage and they are responsible for metabolism. Joint fluid is the main source synthesized by the synovial tissue for the nutrition of the cartilage. The tissue doesn't have any vascularity and lymphatic drainage and neural innervation either. Weight wearing in health joints is therefore painless, but it hurts in any type of damage. Poor nutritional support is an obstacle for regeneration and repair of cartilage. Therefore, we have concentrated our effort on medical treatment for helping joint repair. The severity of the damage or amount of degeneration at the joint has to be evaluated prior to treatment. MRI is the best examination method used widely in clinics. In mild forms of the disease, platelet-rich plasma injections and mesenchymal stem cell therapies have good results and in relieving pain and cartilage regenerations. These regenerative treatment alternatives containing cells harvested from the patient himself and local acting growth factors for stimulating cellular growth and protein synthesis. They differ in cellular actions and methodology of harvesting. Platelet-rich plasma, PRP, is prepared from the drawn venous blood. The process based on a simple centrifuge of a tube blood for separation platelets from the other cells of blood, white and red blood cells. The bottom of the precipitate called Buffy coat is the portion contains the highest concentrate of platelets. Platelets mainly responsible for clotting of the blood have certain local acting growth factors which are initiating some regenerative mechanisms. Some of them are insulin-like growth factor, transforming growth factor, bone morphogenic growth factor, etc., etc. On the other hand, mesenchymal stem cells are harvested with more difficult procedures from solid tissues like adipose or bone marrow tissues. However, they have much greater number of cells with more regenerative capacity. Mesenchymal stem cells plays not only a stimulating role, they participate to reforming regenerative tissues thanks to their differentiation capacity to the target tissue. Regenerative mechanisms of these cellular therapies are widely used in clinics due to shown laboratory successful results on animal experiments. However, clinical evidence of this therapy is not proven for humans since time being with a parallel success ratio. I have an experience of intra-articular injections about on more than 10,000 of patients with great success. Fortunately, choosing the right candidate for the treatment is the key point for being clinically successful. After treatment requires simple rest and ice. Any motion restriction is not required. In the early days after injection, swelling or pain may be seen by a small portion of patients. Medication, especially anti-inflammatory medicines, may decrease the regenerative effect of the treatment. The patient with having mechanical malalignment or joint instability cannot benefit exactly from this treatment. degenerated joints which show severely collapse of joint space on X-ray or present gross osteophytes or loose bodies are also not suitable. Deep cartilage lesions can be treated surgically. Mosaic-plasty or scaffold replacement techniques may be preferred according to the amount of the lesion and the location of the defects. In patients with end-stage joint disease, prosthetic replacements would be rational treatment modalities despite other regenerative modalities. Thanks for watching. Have a nice day.